Cause and effect diagrams provide a visual means of conveying all suspected and possible causes and consequences of a specific problem. Cause and effect diagrams are used to identify sources of process variation and to investigate detrimental causes and effects so they can be corrected. They are also used to investigate positive effects and to determine which causes allowed it to occur. Cause and effect diagrams also serve as a cause prevention tool by evaluating how to avoid future problems. In applying the case scenario presented earlier, the diagram was divided into 5 categories: people, processes, equipment, leadership, and culture. With the causes on the one side of the diagram and the desired effect or outcome on the other side. The desired outcome or effect can also be seen as your aim statement. In other words, what are you trying to accomplish? Your aim statement should be specific about measure, time, and population. In other words, how good, by when, and for whom. The aim statement I created for our unit was to decrease the reportable hospital-acquired pressure ulcers in the ICU to 0 to 1 over the next 12 months. People involved in the case are the nurses, physicians, dietitians, and leadership or administration. Processes include things we can do to prevent pressure ulcers, or if we don't follow the processes, it can lead to the development of a pressure ulcer. Materials and equipment would include the things that are used or could be used to prevent pressure ulcers. Leadership involvement includes the collection of data and analyzing it to see where improvements can be made. Is leadership providing enough support and training to staff? And is the skin champion making rounds, encouraging and educating staff on current treatment modalities and evidence-based practice? Lastly, culture. Are the nurses on the unit overworked? Do they have enough support staff to help them with turning and repositioning? Are positive attitudes regarding pressure ulcers affected due to lack of support? And what are the attitudes towards using turning clocks? Are nurses excited about the turning clocks, or are they a nuisance? Do nurses say, "I don't need a turn clock, I know when to turn my patients"? All these categories have elements that can contribute to the development of pressure ulcers when left undone or people aren't doing what they're asked to do.